Hi, I'm Dr. Gvantsa Khizanishvili, and this is Global Health Unpacked, a weekly OncoDaily short video series spotlighting the latest global health trends with leaders shaping the future of global health and cancer. And today I'm joined by Carolyn Taylor, founder of Global Focus on Cancer. We are going to unpack people-centered care and the role of lived experiences across cancer care continuum. Carolyn, welcome, and thank you so much for joining us today.
Thanks, Gvantsa. It's a pleasure to be with you.
To start off, could you briefly introduce this topic and explain why it matters right now for global health and cancer care?
Yeah, so I think, when you think about people-centered care, there's lots of different definitions, but quite difficult to actually put one finger on. I think we use different definitions for it. We have people-centered care, we have patient-centered care, we have person-centered care. There's lots of different ways we use this term, but very few ways that we operationalize it or actually put it into practice. When I think about it, I really think that it's, we think about how people access systems, right? And particularly in cancer care, we see that people have these extended waits, that care pathways are fragmented, limited support, particularly psychosocial support is the work that I'm interested in, but also this like financial challenges. But really it's about trust in the system. And I think when I think about people-centered care, really thinking about how do we clarify what that means, how do we define it, how do we measure it, how do we implement it to really address these challenges that people face when accessing cancer care.
I really like how you framed it. And this is not an add-on, right? It's something
No.
essential to how cancer systems should be designed. And I want to build on that. And from your perspective, what process has been working? What progress have we been making so far? And where do you see the biggest gaps? What are the opportunities for improvement once we are moving forward?
So I think, the WHO has championed this for years, thinking about people-centered care and building framework on meaningful engagement of people with lived experience. I think that framework is a great basis for it. Also, my work now with this Lancet Commission on people-centered care for universal health coverage, really trying to define what this means in having one universal kind of context as to what people-centered care means, and then working with systems to really develop systems that work around people. How do we meet people where they live? How do we actually address those social determinants of health that will provide better access to patients and their families? And I think that's a direction we need to go. And looking at existing frameworks, looking at also the WHO, the rights-based language and the rights-based contexts that are there, the right to social participation, the right to health, and how do we work from that? So I think not trying to reinvent the wheel, but kind of galvanize it and systematize what's existing.
Absolutely. And what's striking me, it's also that it's a lot of it is a mindset change, right? It's not only policies and structures, it's also the whole mindset. And looking ahead, what are some of these key trends and shifts should we be paying attention to as this area continues to evolve?
So it's power. It's really where power sits, right? And right now, people don't have power. You don't have power in your own healthcare. You don't have power in the decisions necessarily. You're really so I think the shift in power to a more people-centered approach, also in defining research in a lot of ways too. Research is done often around what academia, what careers, for people's careers, and not necessarily around what's really meaningful and important to people living with the disease. And I think we need to have that shift in a meaningful way.
Wonderful. I'm really looking forward to more progress in this space. Carolyn, thank you so much for sharing your insights and for working and all the work that you're doing to advance people-centered care globally. And with that, I would like to say goodbye and hope to see you back in our show again.
Thank you so much, Gvantsa. It's a pleasure to be with you. And thank you, OncoDaily, for all the work that you're doing to support meaningful engagement of people with lived experience. It's really wonderful to work with you all.
Thank you for watching Global Health Unpacked with Dr. Gvantsa Khizanishvili. I'd love to hear from you how you see people-centered care and lived experiences shaping cancer care in your own context. Share your thoughts and follow OncoDaily for more conversations like this.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.